My name is Monika Ulrichová, and I would like to talk about education and training of social professionals for families of seriously ill people. So I would like to talk about the role of the social worker first, because the role of the social workers and other professionals is irreplaceable. I mean also psychologists, doctors, and all people who is taking care about our sick people. This fact is probably common knowledge, but the period of the pandemic of COVID-19 showed us that it was the elderly who suffered the most during this time. In addition, people who were sick and dying and who were restricted in their movements by the diagnosis itself had to endure after several restrictions, such as a loss of contact with loved ones and relatives, and some even had to isolate themselves completely. It was during this period that the importance of the care of social workers and other professionals, as I said, such as psychologists, for the social life of the sick people became all the more apparent, as they were the only ones who could often have regular contact with this group. The social workers help the client as well as her family to manage all matters related to her health and social and spiritual development. The social workers not only helps to handle the necessary benefits of the clients, and is it often perceived by the general public, but also help with much more complex matters that they are important to the client, such as a sudden situation even in a hospital facility, or even deal with foster care for orphanage children who find themselves completely alone due to the death of their parents. The social worker plays a vital role in ensuring that the needs and wishes of the patient and family are reflected in the planned medical care. Many clients find it difficult to cope with their situation, sometimes unexpected. So it's very important now to talk about personality profile of a person working with a sick or dying person. The personality of the professionals working with the seriously ill people should meet qualifications other than those required by the occupation and legislative framework of the professionals and the particular institution. The personality should be equipped with characteristics that they are close to other professionals, such as psychologists and psychotherapists, who are also near seriously ill or even dying people. These characteristics include self-acceptance, loving and generous relationship with oneself that involves working on oneself. Self-acceptance means that I am aware of my weakness, accepting of them and able not be static. Self-acceptance tests relationality specifically with other people and especially with those who are weak and at the particular moment. Other necessary personality characteristics include self-acceptance. Self-acceptance means that when we are overwhelmed with different information or emotionality, we can take a step as aware and look at ourselves with distance. This is very important, the distance. Self-distance brings another wonderful characteristics, and that is inner freedom. A professional who has this completeness does not transfer his or her own, albeit well-intentioned, views of particular situation onto his or her client. Another very important characteristic is self-transcendence. Self-transcendence means that a person can come out or himself for something that transcends him. In social and teaching work, this is very important characteristic. As a professional who has had this direct experience in an oncology ward, I know how extremely important it is to take care not only of the dying person, but also of the survivors and their families. Often we see families who do not have open and honest communication with each other, and this can be one of the best tools for the patient to manage their illness well. Together, people's transitions are much better managed. So, I would like to talk now about the research questions and about the methodology, because we obviously can see how important is the relationship with dying person and how important is it with family members. So the research was conducted using quality research methods by semi-structured interviews with individual family members of the patients who visited the oncology clients or oncology clinic of the university hospital. Some relatives visited the patient regularly, so I've interviewed these relatives of the patient. By listening to the stories and asking questions, the individual's response had enough space to express their opinions and practical examples, only slightly limited by the identical sub-questions. The research aimed to find out how the family is involved in the care of their seriously ill members and how the family itself is also taken care by the hospital professionals. Guiding questions for semi-structured interviews were developed. First question was, how did you perceive your life before your loved one became ill? Second question was, how do you cope to perceive the situation you are in now? Third question, what helps you cope with the difficulties? 4. What you find most difficult in the whole situation? And last one, what would you need from professionals in the hospital? I must say that it wasn't easy, because the interview with these family members was sometimes very emotionally hard, and it wasn't such easy, but we find out many important information. So what did we find out? The main aim of the research was specifically or specify how family members manage their care and whether the family is, if the family are supported. It was very, very important. In response to the first question, for example, how did you perceive your life before your loved one became ill? The majority of response answered that they did not know what fear and anxiety were until now. The most response reported life was often on the surface, that only now do they see what the real concern is, and that they have changed some of their values. For example, about the second question, the young people, their parents, were targeted as driven into the corner. However, some response see the point in accompanying the sick people, and the response said, what else am I supposed to do? I am glad I can help him, or her, of course. The paper aims to highlight one very important role, and this is the role of social worker, their erudition, which directly affects the care of seriously ill people. And about another question, for example, first question, which related to what helps the family cope with difficulties. Response reported the belief that it was meant to be, saying it's a fate. Another stated that there was nothing else to be done, but one had to take it as it was to face it. The husband, for example, of the sick woman said that the children were holding him up, that he just had to take care of the children or he would break down. For fourth question, for example, which related to what relatives found most difficult, was that often the cancer diagnosis came suddenly, unexpectedly, especially for a young woman with breast cancer. The same interview with the mother of the patient, 25-year-old son, revealed that the most difficult things was the disease came so quickly and that it was rare. The hardest part was also that they did not know how to talk to their relatives, the patient himself, and that they said were afraid to ask. One respondent claimed that he was left all alone in this. One respondent said that the worst part was coming to terms with the fact that there was no longer any treatment for her mom. On the final question, what the family would most need from staff, the response was very similar. The majority said that they need to sit down quietly and ask basic things, what the future looked like, what the prognosis was, and what they could do for the patient. Respondents expressed themselves in the sense that they lacked open communication, that they missed the time that staff would give them. What it seems like the staff were always on the run. They consider the treatment they receive from their loved ones to be sufficient. They needed more emotional support at the time. What is the conclusion? In the practical part, we interview family members, and the crucial findings was that family lacked the time that professionals would not give them. Doctors were often mentioned. The family lamented that everything happened quickly in corridor, and rarely does a professional sit down and talk to the family openly without rushing, creating the calm atmosphere that family members crave. Most families are stressed by their loved one's illness, so time is often the most precious commodity for them. Most families are happy to be involved in the care of their sick loved ones. They see it as a meaningful time spent, whether is it visiting them in the hospital or planning for their loved ones or to their homes. This is the basic of our research. Thank you for your patience, and I would like to tell you that if you have any questions or any discussion, you can write me or this email. Thank you so much. Bye-bye.